Mr. Rosen.
Good morning. Thanks for having me.
You're quite welcome. How are you?
I'm great. I'm great.
So how does this go down with your patients, these essentially holistic alternatives?
That's how it started.
Yeah.
Actually, it was a dad in my practice, Jeff Cohn, who I wrote the book with, who came to me and said, this is what you do every day. These stories in this book, this is how we practice. My wife and I like it very much. I write books. Let's write a book together. So the book really stories from a parent and a pediatrician perspective about how we can keep our kids healthy and pick natural things that help avoid side effects.
Okay, so a kid has a fever, for example, which all kids get.
Yep.
And parents normally give them what?
Yeah, Tylenol, Advil, something like that.
What are you recommending?
Actually, no medicine at all, usually. People are afraid of fever. That's part of the problem.
Sure.
So a lot of it's about education and saying fever is not dangerous, but there are a few things. You don't want your kid to be miserable. So you can take a washcloth with cool water. There are some homeopathic remedies that we use. Specifically, belladonna is one of them. And so people say, well, belladonna, that's foxglove, that's poison. But you have to understand what homeopathy is. And so it brings in a whole other area of natural medicine. And these are things parents can actually do at home and feel safe about.
Here's what I do if I want people to think I'm really sick. I tell them I have a fever.
Yeah.
And they take it. Let's just say you call in sick for work, which I used to do all the time because I was drunk. If you just say you have a cold, that doesn't work. No,
not going to fly.
But if you say you have a fever, then it's serious.
Right.
But
we're trained that way. We grow up that way. I'm sick. My child is sick. And, these are signs that our body is doing something. So we're trying to change the paradigm and say it's not just about treating sickness and illness. These are ways our kids deal with infections. It's normal. You're supposed to have. It's just like with germs, right? Where we want to get rid of every last germ in the universe. And like we've seen with the green and cleaning stuff or hand sanitizer that we make from essential oils, you don't have to wipe off every last germ in the universe. You can find ways that are natural and safer to help be healthy.
So our kid has 104 fever, which would be high for me, but I just probably not a kid.
Yeah, different in kids.
And you recommend the parents do a cold washcloth and not immediately grab the Tylenol or the...
Exactly. The interesting thing about, if you look at ER visits for side effects from medications, there was a report a few years ago, over 500,000 ER visits a year from side effects from medications. So we're saying, look, it's not that there's never a role for it, but there are many other things you can do that seem to be much safer.
What if the fever doesn't come down?
Well, you need to have a relationship with your doctor, too. I mean, I think if you're out there in the middle of nowhere, that's a different story.
Sure.
And it's not that there's never a role for ibuprofen or acetaminophen. Sometimes you have to use those medications. There's certain kids who are prone to issues like seizures with fevers. So we're not saying for all kids, but for the most, what the book does is it says, look, whether it's fever, whether it's a cough, whether it's a sore throat, a cold, there are many options out there parents are just starting to learn about. So we're trying to help them with that.
The most overprescribed medicine, probably antibiotics, right?
Yeah, absolutely. And that's one of the when you talk about side effects and ER visits, you're getting gastrointestinal and all kinds of allergic reactions. And so we go through a number of conditions in the book where you might use antibiotics, ear infections, for example.
Right.
It's one of the most reasons for prescribed antibiotics. Even in conventional circles now, we're saying let's move away from that. Interestingly, antibiotics now are linked to obesity. So they're saying, we're disrupting...
fat people taking them.
Yeah, well, we're leading to that.
I get them fat,
Yeah. So...
Connell? Are you listening to this at all?
Every word.
Don't you have 3 children?
3 of them, absolutely.
Well, why don't you pay attention?
I know. I'm going to have to stop giving them Tylenol. Go ahead.
Because he's got 3 kids. He's not,
So,
it's...
I was going to ask you about earaches, so...
Yeah, and so what we do for that is we say, there are a number of things you can do. In the book, we talk about something simple, olive oil. Something everybody has in their kitchen cabinet. Olive oil actually has anti-inflammatory properties, antibacterial, antiviral, and antifungal. So you can take garlic, crush it up in olive oil, just warm it up a little bit, take a few drops, put it in the ear that has an earache. It works magically.
Really?
And it does. And actually, there are research studies comparing it head-to-head with antibiotics and with Tylenol, and showing in some of these studies that it's equally as effective, and you can avoid all the other potential side effects.
Talking with Dr. Lawrence Rosen. His new book is entitled Treatment Alternatives for Children, Reducing Serious Side Effects. And boy, there are lots. And we at the Imus Kids with Cancer, over the past 15 years, have seen the catastrophic side effects that are a result of these kids. Of course, it's a little more serious than Tylenol, but receiving their ration and chemotherapy and so on.
Absolutely.
Well, the battle is, as you well know, and Deirdre faces it all of the time with their cleaning products, is people don't think it works.
Right.
Now, even though for example, her cream, this GTC stuff, is used in over 200 hospitals.
It works better.
Yes, it works better.
Yeah.
But people are conditioned to stuff smelling clean. So how do you combat that?
Well, that's an issue in our medical, if we want to get into healthcare and problems and overuse of stuff. But what you have to say is, let's look at the research. One of the things we did in the book was we said, all right, we get it. People are going to be skeptical. That's okay. But I put a research citation with every single natural remedy I cite so that people can go back and say, all right, I understand. Here's the reason why we are seeing more and more research. Do we need more? Sure. Yeah. But it's a new paradigm. It's a shift. And actually what's interesting is you're going back, hundreds or thousands of years with some of these remedies, with acupuncture, with yoga. These are things that people have used forever, and we're now seeing the research show why they work. As far as the ranch, I remember there's a specific case. I remember there was a girl there who was having allergic reaction to the horses. It was a few years ago, and the conventional answer would have been give Benadryl, but we were concerned. And I know I talked to Deirdre about it. She would be loopy. She'd be tired. She wouldn't be able to ride. She wouldn't be able to do anything. So we had actually on hand. I had a few homeopathic remedies from Boiron that are anti-allergy called Sabadil. Yeah. We gave her 2 of those every 2 to 4 hours. She had no grogginess, no drowsiness. Within 2 doses, she was up on the horses riding, no allergic symptoms. So you never know.
What do you do for a tummy ache?
A lot of different things. Depends
what do parents normally do? Just got a tummy ache, throwing up, that kind of thing.
Yeah, I think that they'll use things to keep them hydrated, like Pedialyte and other stuff, or they'll turn to Tums.
What's the pink stuff?
Yeah, Pepto-Bismol, right. And these things also they can have aspirin in them or other issues we don't want to give to kids, and all the added dyes and sweeteners and stuff you just don't want your kids taking. So chamomile tea, very simple. You can find it in any supermarket. They make nice organic chamomile tea. That works almost just as well in almost every circumstance.
Okay, would you agree, though, that it's always a good idea to have a prescription of Vicodin on hand?
For certain people, I'm sure, yes.
Just in case your kid hurts themselves.
You never know when you might need it.
Exactly.
Yeah.
For example,
there are alternatives for that, of course, too.
We don't have any at my house right now, but you can write prescriptions, can't you?
Yeah, we'll talk later. That's okay.
Dr. Lawrence Rosen, really a fabulous book. It really is. And
thank you.
Because of the side effect, I was talking to Deirdre about it last night, who was obviously a big fan of Dr. Rosen. We take Wyatt to see Dr. Rosen. So because of the side effects of all of these various things that you give kids, particularly antibiotics, which is so overprescribed, as we mentioned, that it's criminal.
Yeah.
It's called Treatment Alternatives for Children. Y'all buy it this morning, Dr. Lawrence Rosen. Dr. Rosen, thank you very much.
Thank you.
It's